It's against this bill. Oh. Welcome and good afternoon. Today is Tuesday, February 27th. I hereby call the Insurance Subcommittee to order. Madam Secretary, please call the roll.
Representatives Sapicki, Himmer, Hicks, Hill, Kumar, Lafferty, Martin, Mitchell, Rudd, Rudder, Terry, Chairman Haynes.
Here.
Chairman Haynes, you have a quorum.
Thank you. Before we get started, are there any personal orders? Seeing none, we have 8 bills on the calendar today. Item number 1 is House Bill 2010 by Chairman Vaughn. Don't see him. We'll roll that to the Hill. Item number 2 is House Bill 2281 by Chairman Hawk. We have a motion and a second. Chairman, you are recognized. I see you have an amendment.
We do. Yes, Chair Lady, we do.
Can you verify the drafting code?
Drafted code is 014428.
Okay, we have a proper motion and second on the amendment. Chairman, we're voting on the amendment. All those in favor, say aye. Opposed? The amendment is on the bill. Chairman, you're recognized on the bill as amended.
Thank you, Chair Lady and members. Last year, we passed House Bill 608 that dealt with pre-licensing course study for insurance producers. In that process, we inadvertently included the title insurance folks who want to be removed from that. So this bill will correct what our title insurance folks are expected to do, as well as the amendment that you just heard will set forth the enacting date as July 1, as opposed to becoming law. Department of Commerce and Insurance prefers that we have a specific start date of July 1 for these bills. So in a nutshell, members and Chair Lady, this is what the bill does.
Thank you. Any questions from the members? Question has been called. All those in favor of sending House Bill 2281 to insurance full signify by saying aye. Aye. Opposed? Aye has it. Bill goes to insurance full.
Thank you, Chair Lady and Committee.
Item number 3, House Bill 2629 by Chairman Baum has been rolled 1 week. Item number 4, House Bill 2631 by Chairman Baum has been rolled 1 week. I'm going to skip over to item.
That's right.
Oh, was it again? Okay. Oh, it's stuck. Okay, sorry about that. Item number 5 is House Bill 2051 by Representative Gant. We have a proper motion and second. Representative, you're recognized on the bill.
Madam Chair, is it okay if I present from here today?
Absolutely.
Okay, thank you very much. House Bill 2051, what this deals with is emergency air medical services transport critically ill or injured patients, regardless of their ability to pay, to the closest, most appropriate hospital when requested by a third-party medical professional or first responder. The air medical provider has no control over the demand for its services or the payer mix of those requiring these services. So roughly 70% of all air medical flights are Medicare and Medicaid, and in Tennessee, a large portion of those transports are in the rural parts of the state. And while both Medicare and TennCare reimbursement at rates well under the cost to perform these transports, TennCare reimburses for these transports at only 34% of Medicare's coverage reimbursement. And this bill looks to increase the TennCare rate to not less than 67.5% of the federal Medicare program's allowable charge, which would match the existing base rate for ground ambulance services. While this increase will still not cover the cost to perform these transports, it would be a large step in the right direction. And Madam Chair and Committee, I'll be glad to try to answer any questions that you may have.
Do we have any questions from the members? Chairman Sapicki, you're recognized.
Thank you, and thank you, Representative Gant. This is an excellent bill to provide this life-saving need. Hopefully, we can keep a better eye on our money that TennCare returns back to the general fund, and maybe allocate some of this money for projects like this in the future. So, thank you.
Thank you very much.
Any further questions? Seeing none, we are now voting. All those in favor of sending House Bill 2051 to insurance full signify by saying aye. Aye. Opposed? The ayes have it. Bill goes to insurance full.
Thank you, Chair Lady.
Thank you. Item number 6, House Bill 1877 by Representative Freeman. We have a proper motion and second.
I also have an amendment that I'd like to put on before we discuss.
Okay. Can you verify the drafting code, please?
14097.
Okay, that's correct. We have a motion and second on the amendment. All those in favor of the amendment signify by saying aye. Aye. Opposed? The amendment is on the bill. You're recognized on the bill as amended.
Thank you, Madam Chair. So I'm going to tell a brief story and then tell you what this bill aims to solve. About 3 months ago, I went to go have a medical procedure done. Had my phone with me because I was told I can't carry anything in. Brought my digital insurance card that was in my Blue Cross Blue Shield app, and it was rejected. They said they do not accept digital insurance cards. When I asked around other doctors in the building, they act as if they'd never heard of that, and it was just a decision on that individual practice. We're moving towards a digital age. We're in the digital age and requiring people to have a physical card. We're talking about moving towards a digital ID. We have our credit cards digitally. And what this bill does is just require physicians, medical facilities to accept digital insurance cards. I've talked to several stakeholders. They felt that it would be, they're moving this way. This is in their long-term plan, but it would be difficult to enact. And so what the amendment that we just put on it is it pushes it out to January of 26. And with that, I stand ready to answer any questions.
Thank you. Representative Hill, you're recognized.
Thank you, Madam Chair. And to the sponsor, when you say the requiring of the digital card, is that only the digital card, or is it the digital card and the physical cards as well?
No, it's
You're recognized.
thank you. And thank you for the question. I should have been more clear. It just says that a digital card is a valid form of proof of insurance. Just like currently, if you get pulled over, not that that's happened to anybody up here, you can show a digital insurance card proving a proof of insurance for your driver's insurance. So the state of Tennessee already understands and accepts that this is a valid form proving insurance. It's just it's extending it to hospitals. So thank you for the question.
Chairman Sapicki.
And just for clarification, to make sure we take away the potential of fraud there, a driver's license would need to be able to identify that person who's using that card, correct?
That I would assume so. That policy that's in place currently with the hospital, I think you have to show a driver's license as well. So yeah, and the speaking of fraud, it's been proven that digital cards reduce fraud because people can take in a fraudulent printed card, and then when they call in, it can be an issue. It's immediate. It's up to date. In many cases, it's in the app that the provider has for you. So,
Any further questions? Chairman, you're recognized.
Thank you. Do you happen to have a copy you could show us of your digital card?
I do. Would you like to see
Yeah,
it for
actually,
real?
yeah, I
Are
would.
we allowed to? We can't have props,
Oh.
though, right?
Yeah, after committee.
I'll email it to you.
Okay. Any further questions? Seeing none. All those in favor of sending House Bill 1877 to insurance full signify by saying aye. Aye. Opposed? The ayes have it. Bill
Thank
goes
you.
to insurance full.
Thank you, Madam Chair and Committee.
Item number 7 is House Bill 2461 by Representative Davis. Have a proper motion and second. Representative, you're recognized on the bill.
Thank you, Madam Chair, and thank you, committee. This bill has to do with remote ultrasound and fetal non-stress testing. Since 2011, hospitals have closed and 217 labor and delivery departments have. Now more than 33% of all U.S. counties are considered maternity care deserts. These closures are occurring while maternity mortality rates and maternal severe morbidity rates increase. This bill would give doctors more options to ensure prenatal care for those mothers who struggle to make routine prenatal appointments. Moms with high-risk pregnancies are often prescribed twice a week the non-stress test in that third trimester, and while also having a certain number of ultrasounds. But making all these prenatal appointments can be difficult or create hardships for some of those mothers, especially if they need to take off work or if they live far from their provider or they lack reliable access to transportation. So one study shows that 28% of a no-show rate there is a no-show rate of high-risk pregnancy clinics. And so if moms are not being screened appropriately, then their doctors can miss potential pregnancy exacerbations that a fetal non-stress test could detect. And so if women have access to more prenatal care, 80% of pregnancy-related deaths could be avoided. So this bill clarifies the current CPT codes for fetal non-stress tests and ultrasound scans that they could be billed when the patient is remote. It has to meet the same standard of care. And in other words, this bill doesn't create a new healthcare service. It just clarifies where that service can take place. And so I have someone here to speak to the bill if we would like to go out of session and have that witness testify.
Okay, thank you. Without objection, we're going to go out of session and hear from Evan Hoffman, Philips North America. You have 3 minutes, and please state your name and who you're with for the record.
Can you hear me? Okay.
Yes.
Hi, Chair Lady Hilton Haynes. My name is Evan Hoffman. I am the Director of State Government Affairs for Philips Healthcare North America. Thanks for the opportunity to join you all today. Representative Davis, thanks for your leadership on this bill. She covered the challenges quite clearly and what this bill seeks to do. So I'll just add a couple of additional thoughts. For those of you who are unfamiliar with Philips, we are a healthcare technology company. We have a big office a couple blocks right up the street from here with about 1,100 employees in Tennessee. We produce everything from ventilators to AEDs to patient monitoring to ultrasound to electric toothbrushes, our Sonicare brand. We also have a very deep legacy in maternal health for the last 30 years as the world's largest provider of obstetrics monitoring solutions in the hospital and one of the largest providers of ultrasound solutions as well. Representative Davis explained how, especially for women in these maternity care deserts, if they have high-risk pregnancies in particular, or even if they don't have a high-risk pregnancy, accessing prenatal care frequently could be quite difficult. You can trace that a lot of our maternal health challenges are because of lack of good care compliance for prescribed prenatal care plans. OB providers have been taking care of high-risk pregnancies for decades and treating them with good health. But often the challenge is a lack of prenatal care compliance. The representative cited a study that shows how 30% of non-stress test appointments aren't made because of this inability to access care. So for Philips, we have been working on innovation in this space over the last few decades to really bring tools like remote ultrasound and remote fetal non-stress tests to bear to give providers more opportunity to use their discretion to offer these care pathways for patients, if that makes sense. This concept is starting to be seen across the country. Last year, Georgia, Pennsylvania, Ohio, and Missouri adopted similar proposals into law that's being considered right now through this bill. Companion legislation just passed the Tennessee Senate unanimously 2 weeks ago. And similar bills have been introduced in around 10 other states. So when we talk to our customers, hospitals and OB providers, they are looking for this clarity in CPT codes. They want to understand that there's a clear path to payment when they offer a remote ultrasound scan that's the same as an ultrasound, for example, in the clinic, but the patient happens to be in a different location than the provider now. So with that, we offer our support and happy to answer questions.
Thank you. Chairman Terry?
Thank you, Chairman. So if somebody, like a patient's at home on bed rest, this would allow a technician to go and perform an ultrasound there and be reimbursed for that. Is that correct?
Yeah, that is correct. And the technology platforms actually enable tele-ultrasound. So the sonographer or the provider can actually be based anywhere in Tennessee. And as long as they have someone trained within the licensing rules, that person can go into that person's house, or even a remote ultrasound clinic that could be more convenient, and conduct that ultrasound appropriately.
Chairman Terry?
Yeah, thank you. That was going to be my follow-up question. So you have the tech there and the technology is sent to somebody, the physician or whoever is going to be able to read it at that point in time. And so we're going to basically have it, it's going to be less risk for the patient because they're on bed rest. And so makes sense to me. All right, thanks.
Any further questions? Okay, thank you very much.
Thank you.
We are now back in session. Would
Thank
like
you,
to-
Madam Chair. And so if anyone has any questions for me, I'll be glad to answer. Otherwise, I would appreciate your support on this legislation.
Any questions? Chairman Terry?
You got a sign-up sheet?
I will. Absolutely.
Any more questions? Seeing none, we're voting. All those in favor of sending House Bill 2461 to insurance full signify by saying aye. Aye. Opposed? The ayes have it. Bill goes to insurance full.
Thank you, Chairman. Thank you, committee.
Item number 8 is House Bill 2048 by Chairman Martin. We have a proper motion and second. I see that you have an amendment.
Yes, ma'am.
Can you verify your drafting code?
013741.
We have a motion and a second on the amendment. This rewrites the bill, so we'll go ahead and put that on the bill. All those in favor of Amendment 13741 signify by saying aye. Aye. Opposed? You can explain your bill as amended.
Thank you, Chair Lady and Committee. This bill was brought to me from the Tennessee Captive Insurance Association, who worked with the Department of Commerce and Insurance on the legislation. About every other year since 2011, in Tennessee, captive insurance statutes has worked to make sure that we stay competitive with other states around us and around the country. A captive just creates insurance for non-insurance parent company. Many businesses in Tennessee and across the country have captives because they see them as a better way to ensure their specific risk and need. This legislation change will allow Tennessee to be more competitive with other states and hopefully have more captives filed here in Tennessee. There are 9 major changes, with 3 of those specifically being allowing a captive to file their annual report, and payments to the DCI will give commissioner discretion to allow captives to go dormant, and allowing 1 incorporator rather than 3 when setting up the captive that is similar to non-captive entities. I have Tony Greer here today to answer any in-depth questions that you might have in regards to this.
Do we have any questions from the members? Seeing none. Any objection to calling of the question? Okay, all those in favor of sending House Bill 2048 to insurance full signify by saying aye. Opposed? The ayes have it. Bill goes to insurance full. We are back to item number 1, House Bill 2010 by Chairman Vaughn. He has rolled that 1 week without objection. We are now at the end of our calendar. Does anyone have any announcements? Seeing none, do we have a motion to adjourn? We are adjourned. Bam.